Okay, so today we're going to take a look at Dakota's case. Dakota came from us from Texas, and if you'll take a look at his panoramic view, this is the pre-op, so this is before I had done anything. And you'll notice he attempted to have the All-on-4 procedure, and so he went ahead and he had those 4 implants placed prior to coming to me. But once I got in there and I found that there's a couple of issues. One, the diameter of these implants were so small. They were 3.5 millimeters in diameter. So there's just not enough, girth of the implant. There's not enough strength in that sort of an implant. A 3.5, you cannot torque, you can't put a lot of torque on those implants. And they're really made for really small teeth, like lower anterior teeth, just really, really small, delicate teeth. And certainly not made for to support a complete arch of teeth like in a case of an All-on-4. So that's the first issue, the fact that the implants were very small diameter. The second issue is the fact that it is an All-on-4. There's just not enough support in the back of the jaw to handle the high load like I talk about all the time in my videos. You know, the load factors back here are extremely high. So if you combine the narrow diameter implant with the position of these implants and what we're asking the implants to do to take on that sort of a load that the whole mouth needs in order to support proper mastication, chewing, and that sort of thing, it's just kind of a recipe for disaster. So a really classic indication and a classic case where an All-on-4 is just not ideal. And in fact, here at Trust Implants, we do not do All-on-4. We do minimum of 6. So in Dakota's case, in fact, once I went in there and reflected the tissue back and was able to visually look and inspect each implant, there was bone loss up to the 3rd or 4th, 5th thread on every single one of these implants. So that was another indication and rationale for me to remove these implants, which I did. I ended up removing all 4 of them. And the available bone, I mean, the surgeon who placed these, I understand why he attempted to do a 3.5. He's not skilled in bone regeneration procedures. He didn't even consider the fact that the implants should go in the back of the jaw, so didn't consider a sinus graft. In fact, didn't even consider, when he did the extractions, doing grafting and grafting the extraction sites. And I can say that because as I'm looking at his CT scan, there was no grafting in any of the sites. So they pulled the teeth, placed the implants, but they didn't graft anywhere. So many factors in this situation that were just not done properly. And so, you know, and these cases start at the beginning of the treatment plan. When I first meet the patient, I'm already putting a plan together and visualizing where I'm headed with the case. And in this situation, you know, I can't really speak for the surgeon who placed these, but there wasn't a whole lot of thought because of the position of these implants, the fact that there's no grafting in any of the extraction sites. In fact, here on the lower where they pulled those teeth on the bottom, no bone grafts at all. And anytime I do an extraction, we graft that site in order to optimize the available bone. It's unfortunate that the patient has lost bone, but let's take advantage of the bone that they have, graft those sites, regenerate the bone, and try to restore as close to possible as, you know, as we can to the dentition or the smile, the aesthetic that the patient has lost. And so here at Trust Implants, we're very adamant about minimizing the reduction of bone. You'll see, you know, if you go to an All-on-4 center, they're going to do a lot of bone reduction. We don't do that here. We maintain as much bone as we can to optimize the aesthetic result, the functional result, as well as minimize the dimensions of the prosthesis. If you remove 10 millimeters of bone, you're going to have a prosthesis that's very thick. It affects your speech, it affects the aesthetics. There's so many factors that are affected by doing that. But that's the standard protocol for All-on-4, to just reduce the bone down to a certain level, and it's usually beyond the apex of the extraction site. And so that's a lot of bone to remove. And so we'll take a look at Dakota's case and kind of look at some of the, you know, during the surgery, what I found, the amount of bone loss I found around each of these implants, a very narrow diameter implant, certainly not a large enough implant to handle an all-on-4 and or a full arch of teeth. And so, you know, it's pretty standardized. Everybody out there is doing all-on-4 procedure, but without really thinking about the consequences. You know, unfortunately, this patient has spent thousands and thousands of dollars and then had to have it all redone. So patients who are considering the procedure, you definitely want to do your homework and look at, it just makes sense, right? I mean, if 4 implants versus 6 or 8, there's just no question. And if you're going to spend or make that sort of an investment, make sure that when you do it, you understand what you're getting into. And an all-on-4 procedure, you know, here at Trust Implants, we just don't do them. We do minimum of 6 or more implants in order to provide a foundation that is secure, that the patient can count on, and that the rest of their life they'll be able to chew and eat and enjoy the investment that they've made. Because it is transformative, but all-on-4 and 4 implants is just simply not enough implants. I'm Dr. Willardsen, and thanks for watching.